Yes, now, today I just wanted to bring a few highlights on one of the specialized dressings that we usually do um, in wood management. It is not our conventional dressing, okay? It is one of the dressings that we do, which we place in the category of specialized dressings. So this dressing is called negative pressure wood therapy. Now you have heard terms like VAC, which stands for vacuum assisted closure or vacuum dressing. VAC is a name that originated from Kinetic Incorporation's KCI in the US. So it may not properly fit the name of this dressing. The ideal name is negative pressure wood therapy. So I'll be very brief, and I want to be very clear and simple so that then those friends who are not medics can also be able to understand what exactly I'm talking about now. So maybe you have a patient and you have gone to some specialists and they have told you that we want to put you on machine. So what that means is that the patient will not be put on a conventional dressing. They will be put on a dressing that involves a machine and other products. All right. So basically, what happens is that the dressing usually uses pressure, okay, to be able to optimize the wood for the next phase of management. Now, apart from the machine, of course, the common accessories are polyurethane foam dressings, and sometimes even this kind of dressings that look like roses and actually roses. I want to briefly talk about that. Yeah, so basically, most woods will benefit from this dressing. Okay, most of the woods. Okay, but there's a precaution for some of the patients who have undergone abdominal surgeries with end-to-end anastomosis, or those patients who have suspected fistulas. Okay, so that category of patients, we should be very careful when applying this dressing on those patients, because there is a possibility or possibly either causing anastomotic leaks or widening an existing intracutaneous fistula. The other category of patients that we need to take precaution when applying this dressing on, of course, are those patients who have issues like bleeding disorders, or those who are on anticoagulant therapy. Okay, those patients who have untreated osteomyelitis, bone infection. Okay, yeah, but basically most of the woods will benefit from negative pressure wood therapy. So the dressing works by availing pressure at the wood base. And I don't want to go so deep in explaining this. I just want to say that the dressing will actually improve perfusion at the wood base. And there are two forces that are usually plays a very key role here. One of them is called macro strain that works on the periwood area. It pushes the wood towards the center, reducing the dimensions, and the micro strain that works at the cellular level, improving what we call the extracellular matrix. So it has been noticed by some researchers that when you strain or when you put cells under pressure, when you put them under pressure, there's potential to create molecular pathways to angiogenesis, including of new blood vessels. And that is how perfusion actually improves. So with improved blood supply, then of course we fast track the granulation tissue, or the tissue that we need for the wound to heal. So basically, in a nutshell, that's how the dressing works. It actually accelerates wound healing. And I've used this dressing for many years, and I've seen the advantage of negative pressure wood therapy. It will accelerate wound healing very fast, it will give you good granulation, it will reduce edema. If your wood involves edema, it causes fluid sheets and causes edema to reduce actually. It also will manage the smell from some of the woods that are smelling, because the machine comes with a collecting chamber where exudate goes, all right? And it also reduces the frequency for dressing changes. So it's a dressing that some people find expensive, but in the long run it becomes cheap for most of your patients. Yeah, so keep following for more. I will be discussing cardiac pressure for a while, and then later, of course, we'll discuss a few tips on stomach complications. Thank you so much for you guys who have been following me. You are really encouraging. You can still ask questions, and we will answer. Remember, we are still training in wood and hospital management. And those guys who are interested can actually get in touch with me for more details.